Hi guys, today we are going to deal about another topic, that is complication and minor ailments of puerperium. So you know about puerperal period. Okay. The puerperium is the period after the delivery. Okay. So and the duration of puerperium is about 6 weeks. Many changes anatomically as well as physiologically happens during puerperium. So, during this preparatory period, many complications can be faced by a postpartum mother. So that we are going to deal in this class. And along with that, there is also minor ailments of preparatory. As you have earlier, you have studied about the minor ailments during pregnancy. There are different, according to system wise, we have studied the minor ailments and its management. Likewise, in preparatory also there are some minor ailments during preparatory. So first, as we said, the preparing is a period of adjustment after the childbirth, during which the mother's reproductive system returns to its normal pre-pregnant state, triggered by a sharp drop in the levels of estrogen and progesterone produced by the placenta during pregnancy. The uterus shrinks back to its normal size and resumes its pre-birth position by the 6th week. So, whatever the changes that happen during the pregnancy and pregnancy for the labor, so whatever changes happen, so the reproductive system, the entire reproductive system will be going back to its pre-pregnant state. That is actually what happens during the preparing. And these changes are due to during the pregnancy. The changes are due to hormonal, due to the changes in the hormone. Okay. So and even there are some anatomical changes. In puerperium, the same thing. Whatever this changes happens due to the changes in the level of the hormones such as estrogen, progesterone, and even and also anatomically the uterus and other reproductive organs, they will revert back to its pre-pregnant state. That is actually we term it as involution. Okay, so all these changes happens during puerperium. So we know about all this already. We have dealt about this topic. So in during the puerperium, all the pelvic organs, body tissues, especially the pelvic organs, revert back to its pre-pregnant state, both anatomically as well as physiologically. And the puerperium has been divided into three, that is immediate, recent, and remote. Immediate means after delivery within 24 hours, and recent, that is within 7 days, and remote is up to the end of 6 weeks. Now we are going to deal about the minor ailments of puerperium. So the first point is after pain. After pain means it is a pain which happens during something, that is after pain. What it is infrequent spasmodic pain felt in the lower abdomen after delivery for a variable period of 2 to 4 days. So after the delivery, the mother may be feeling infrequent and spasmodic pain. The location of the pain will be lower abdomen and for 2 to 4 days. And this why this happens, it can be due to the presence of blood clots or some tissues uh, that is remained inside the uterus, that can cause the hypertonic contraction of the uterus, so as to expel the clots or tissues, whatever is remaining inside the uterus. So that is about the after pain. It is an infrequent and spasmodic pain that is felt in the lower abdomen after the delivery for a variable period of 2 to 4 days. So in this case, how we are supposed to manage? So after pain is quite common in every postnatal mothers. So here, the management aspect, it includes the massaging the uterus with expulsion of clots following the administration of analgesics and antispasmodics. So we can just massage the uterus, and the clots will be expelled out. And meanwhile, we can administer antispasmodics as well as analgesics. And even we can relieve the pain by emptying the bladder. We can provide a prone position with a pillow under the lower abdomen. So what happens? This pillow which we have kept in the lower abdomen, so that will pressurize the abdomen. It will apply a constant pressure against the uterus. So the uterus will be contracted, and then birth pains can be reduced, and whatever has to be expelled out, that can be expelled out. Next is pain on the perineum. So it is quite common. It's in pain on the perineum that can happen after the postnatal period, because during the perineum, during the labor, the mother has her perineum stretched a lot in order to expel the baby. Okay, so in this case, we should examine. We should not neglect that condition. We should examine the perineum to see whether there are any abnormalities or any hematoma has been formed or not. We should carefully, we should monitor it, and symptomatically we can administer some analgesics in order to relieve the pain. In the signs and symptoms, the pain can be severe and sharp perineal pain, and the mother may feel some during examination we will feel discolored skin. We will be able to see the discolored skin, tense and sensitive mass. Then there will be swelling in the perineal wall, and often or most probably this perineal swelling, it can be seen on the opposite side of the episiotomy. Inability to void due to pressure or edema on or around the urethra, complaint of fullness or pressure in the vagina. So this can be the signs and symptoms. So the treatment is to reduce the discomfort. Analgesics can be given, and if the hematoma is there, we have to open the hematoma so that we can remove the blood clots, and it can be evacuated. And if bleeding persists, the bleeders can be ligated and packing for the pressure, like incision and drainage, what we used to do, like that. If hematoma is there, it has to be incised and the blood clots has to be removed. Nursing interventions, you have to apply ice over the area of the hematoma, and we have to observe carefully whether to see whether the hematoma it's increased in size or not. Then we have to flag the patient's chart if packing was inserted. As I said, we have to remove the clothes. After that, we have to apply packing inside the wound. So, if it is done, then we should chart on the patient's paper that packing has been kept. And to give additional relief, six baths, hot or cold six bath can be provided. The next topic is puerperal sepsis. So the name itself indicates what is puerperal. So puerperal means it is related to the puerperium period, and sepsis is related to the infection. Okay, so an infection of the genital tract which occurs as a complication of delivery, that is known as puerperal sepsis. So we know sepsis is an infection, and where this infection will happen, it will happen over the genital tract. And why it is happening? It is happening as a complication of delivery. So, what is puerperal sepsis? It is an infection where at the genital tract, and why? As a complication of delivery. That is known as puerperal sepsis. Okay. Now, the risk factors or predisposing factors. It can, according to the period, it is being divided like antepartum factors. Antepartum means during the pregnancy stage, due to some conditions at the puerperal period, the mother can have this condition, puerperal sepsis. The first one is if the mother is malnourished, and if she is an anemic patient, pre-eclampsia, premature rupture of membrane, chronic debilitating illnesses, sexual intercourse. So, if during the antenatal period, if the mother had any one of these factors, then there is more chance to get puerperal sepsis during puerperium period. Malnutrition, anemia, preeclampsia, premature rupture of membrane, chronic debilitating illnesses, and sexual intercourse. Now, there are some intrapartum factors like during the internal exam. For example, during the labor, the pervaginal examination has been performed, or rupture of membrane has been performed. So, during that period, if the proper sepsis is not maintained, then it can cause puerperal sepsis. Then dehydration, ketoacidosis, traumatic operative delivery, any hemorrhages, placenta previa. So all this can lead to puerperal sepsis. Okay, these are the intrapartum factors. Next is the investigation. So what we are supposed to do, we should collect the history, We have to clinically examine the patient. Investigation has to be done because of this infection. So we have to see, investigate the urine. Urine culture can be done. Urine, blood culture and vaginal swabs for the culture has to be taken. Now the treatment is ampicillin 500 mg intramuscularly, gentamicin 3 to 5 mg per kg body weight, cefuroxime 750 mg intravenously, metronidazole 0.5 gram intravenously. Okay. Next, prophylaxis as a preventive measure to avoid the puerperal sepsis. What can be done? So some measures we are supposed to do during the antenatal, during the intranatal period, as well as during the postpartum period. The case of antenatal period, what we have to do, we should detect and eradicate the sepsis. Where is the infection? We have to see where is the septic focus, and we have to find out, and we have to eradicate the sepsis where it is localized. If we are neglecting it, it can cause major problem. Next, to maintain or improve the health status, as in predisposing factors, we said that malnourished and anemic patients, mothers, they are more prone to have puerperal sepsis. So, antenatal period itself, by screening, we will find out the health status, hemoglobin level, and risk factors. We are screening the patient. So, if we find out that the mother is malnourished, if the mother is anemic, so antenatal period itself, proper care has to be taken. And another important thing is personal hygiene has to be taken care. So that is the antenatal period. This thing has to be kept in mind. Now in intranatal period, we said that during internal examination, infection can be spread. The infection we are, if we are not following aseptic technique, so we are making the we are making the patient infectious. Okay, so here the delivery should be conducted under full aseptic technique. Whatever we are doing, even we are vaginal examination, we are doing amniotomy. So whatever we are doing, it should be under aseptic technique. And patient is instructed not to touch the vulva during labor. And if the patient during the delivery, if we notice that excessive blood loss was there, so we have to manage it. If the patient had pph, so what we have to do, we have to manage it properly so as to improve the general health status of the patient. Then prophylactically antibiotics has to be given. If we see that if a patient came with a complaint of pervaginal leaking, so here there are chances of ascending infection. It can affect the fetus as well as the mother. So in order to avoid this, prophylactically antibiotics has to be started for the mother during the intranatal period. Now during the during the intranatal period, there are some other methods, like we have to wear all the ppes, whatever the personal protective equipment has to be worn by the staff. Hand washing has to be performed, and sterile techniques, and unnecessarily vaginal examination should not be done, because we are introducing infection to the mother. So we have to avoid unnecessary vaginal examination. Now, during the postpartum period, also, in order to avoid the puerperal sepsis, we should be very careful. Like during the perineal, we should perform proper perineal care, and this perineal care should be under proper aseptic technique, and visitors has to be limited. We should provide sterilized pads for the mother and instruct the mother to change it frequently, and advise the mother to perform hand washing and cleaning the perineum from front to back. First, the front region has to be clean, then the back rectum has to be clean. So that we have to instruct the mother. And if respiratory infectious visitors to be avoided, and even if the staff is having some respiratory infection, they should be excluded from the care of the patient. And the most important thing is early ambulation. So the mother has to be encouraged to perform early ambulation, or as a nurse we should assist the mother to do early ambulation. And daily base on the daily basis we should you assess the fundal height of the mother so as to document the involution of fetus. I think you know what is involution. It is the what happens, the reproductive system organs, it will be revert back, it will go back to its pre-pregnant state. That is known as involution. So here we are seeing about the involution of the uterus. By assessing the fundal height, we will get whether the uterus is involuting to its pregnant state in normal basis or not. So that we are supposed to do. Now, nursing care. So here we know everything. So isolation is important. Then hand washing, and patient has to be kept in Fowler's position so as to drain the secretions. Okay, drainage. Then we have to educate the patient about the hand washing and the perineal care. And emotional support is very important, and rooming in can be provided. Rooming in means we are allowing the baby to be with the mother. So it will emotionally bonding will be maintained with the baby. Vital signs has to be checked, intake and output chart has to be maintained. And if we feel that if we during investigation we found out that mother is anemic, so blood transfusion has to be done in order to correct the anemia. And proper rest has to be given if the mother is feeling discomfort in due to pain or due to insomnia. So sufficient rest is provided by administering analgesics and sedatives. So that is about puerperal sepsis. Now we are going to deal about puerperal pyrexia. Here itself the name indicates that puerperal pyrexia. Pyrexia means it is an increase in the temperature. Body temperature will be elevated, and that too in puerperal period. That is puerperal pyrexia. So the definition is an elevation of temperature to 38 degrees Celsius, that is 100.4 degree Fahrenheit or more, occurring on two separate occasions at 24 hours apart, excluding the first 24 day, not day, excluding the first 24 days following delivery, is called puerperal sepsis. An elevation of temperature to 38 degrees Celsius or 100.4 degree Fahrenheit or more, occurring on two separate occasions at 24 hours apart following the delivery, is called puerperal sepsis. So what happened? The temperature will be elevated above or to 100.4 degree Fahrenheit or more, and in two separate occasions. That is not immediately after delivery, the first 24 hour we are excluding it, we are removing it. We will be seeing after the 24 hours, if the delivery has taken place yesterday, so the entire day we are omitting it, we are removing it. And today morning 6 o'clock, if the mother had fever, and again she had got fever at 24 hours apart. Okay. So following delivery, that is known as puerperal sepsis. So the first thing is temperature will be elevated, and excluding the first day, the and the mother will be having two spikes of temperature rise at the 24 hours apart. That is known as puerperal sepsis. Now, what can be the causes puerperal sepsis? So that is puerperal. So what we had discussed is puerperal pyrexia definition. Now the causes are puerperal sepsis, UTI, urinary tract infection, can lead to puerperal pyrexia. That's cystitis, inflammation of urinary bladder, pyelonephritis. Okay, then breast infection, infection of laparotomy wound in case of cesarean section. Or even in the if the cesarean wound is infected, then the mother will have puerperal pyrexia. Intercurrent infection means mother is already some medical infection like bronchitis, influenza, pneumonia, appendicitis, and enteric fever. That is also coming during the puerperium. Then it is known as intercurrent infection. Okay, so this can be the causes. Next is nursing management. We know it is infectious. The mother is having infection. That's why she has developed puerperal pyrexia. So isolation is important. Hand washing, follows position in order to facilitate the drainage. Educate regarding hand washing and perineal care, then emotional support, vital signs, fluid intake and output. Chart should be maintained. Rest has to be provided by enforcing analgesics and sedatives. Now, next is sub-involution of uterus. So, you know what is involution of uterus. Now, we will see what is sub-involution of uterus. So, impaired and deficient involution of uterus is known as sub-involution. What it is, you know, the involution, the rate of involution per day should be 1.25 centimeter. Okay, so if it is impaired or it is not happening, then it is known as sub-involution. When the uterus is not reverted back to the pre-pregnant, both anatomically and physiologically, then we can term it as sub-involution of uterus. Now, what can be the causes? That is predisposing factors, whatever we discussed in the previous slides. That was malnutrition, anemia, pre-eclampsia that can lead to subinvolution. Another one is grand multiparity, overdistension of uterus in twins and hydramnios, maternal ill health, cesarean section, collapse of the uterus, uterine fibroid, or there is no sucking of the baby. So this thing can lead to subinvolution of uterus. Now the clinical features, we know there is no involution or the involution is impaired. So the fundal height, uterine height will be more than the normal for the particular day of postpartum, and the lochia will be excessive or prolonged. What is lochia? It is a pervaginal discharge after the delivery. During the puerperium, what are the secretion that is coming from the vagina? Vaginal discharge is known as lochia. We know that there are three types of lochia. So in case if the lochia is excessive or it is prolonged, it is usually it is 15 days of discharge. It is for a fortnight, that is for 15 days the vaginal secretions will be there, that is known as lochia. But in case if it is prolonging, okay, then we can doubt it is subinvolution. And then there will be irregular or excessive uterine bleeding, irregular cramp like pain, and as we said, uterine height will be more than the normal for the particular day of the postpartum. So these are the clinical features. Now the management, according to the causes, it should be managed. While we will find out the cause, and the cause has to be removed. The cause has to be treated, then subinvolution can be managed. We know that if patient is having infection, then we have to provide antibiotics. If there is any retained products, then we have to remove the retained products from the uterus. That exploration of the uterus has to be done. And if the uterine prolapse is the reason, we have to insert pessary, or it is retroversion of uterus, and we have to insert pessary. And early ambulation has to be encouraged, and daily we have to monitor the fundal height of the fundal height of the mother. Okay. So that was about the subinvolution. Now we will see the breast disorders. So the breast disorders are classified in female, it is classified as nipple disorders and breast infection. So in nipple disorders, inverted nipple, retracted nipple, and accessory nipples. I think you all are aware about these terms: inverted nipple, retracted nipple, and accessory nipple. First one is inverted nipple. So here what happens, nipple instead of pointing outwards, it is retracted into the breast. So there the nipple is not erect. So here instead of pointing outward, it is retracted into the breast. That is inverted nipple. So what happens in this case, the baby will not be able to suck the breast. Okay. So here, what can be the management, and mother, even mother can feel emotionally, she will be disturbed, and the lactation will not be proper. Baby is not able to lactate. Okay, so this can affect the baby also. So what we can do, breast pump can be used, or electrical pump is also available, or nipple shield can be applied. So available in market, so it can be applied, and frequent stimulation can be done. And in this case, uh, this due to this reason only, we are encouraging the antenatal mothers to perform breast massaging during antenatal period. Okay, during taking bath, she's supposed to apply oil and she has to massage the breast so as to make the nipple erect. Sorry. So frequent stimulation even after the delivery also frequent stimulation has to be done in case of inverted nipple. So these are the breast pump. Even manual is available, electrical is available. This is the nipple sheet. It is just applied over the areola. So when the baby sucks, the nipple will be erected and even the milk will be ejected out and baby can suck it. And other methods, it is plastic surgery, nipple piercing, regular stimulation, suction cup or clamps, homemade nipple protractor. This can be done for the management of inverted nipple. These are the suction cups. Next is cracked nipple. It is a condition in which so cracked, we know what is cracked lips. Due to the during the winter season, our lips used to crack. So why it is because of the less moisture. So what here also what happens? The surface epithelium around the areola that will be lost. So what happens? It is a condition in which there is loss of surface epithelium with the formation of raw area on the nipple along with the fissure situated either at the tip or of the base of the nipple. So what happens? The surface epithelium, which usually it is present, but in this case, in that patient, the surface epithelium will be lost, and along with that, there will be a raw area will be present, and even fissures can be situated at the tip or base of the nipple. That is cracked nipple. And what are the causes? Improper hygiene. Okay, and in equilibrium itself, proper hygiene has to be maintained. Breast hygiene has to be maintained. And retracted nipples can also lead to cracked nipple, any injury, or breastfeeding in improper breastfeeding technique. If the baby is not sucking properly, that can also lead to cracked nipples. This is the cracked nipple. You can see here the row area what we had said in the definition. This is the row area at the edge of the nipple. Now symptoms, we know that while sucking the mother will feel painful breastfeeding, and it may lead to even mastitis. What is mastitis? Inflammation of the breast. What is the prophylaxis? We have to maintain hygiene. Okay. The treatment is proper breastfeeding technique has to be taught to the mother, and redemonstration has to be done. And frequently we should monitor whether the mother is adopting the correct technique for the breastfeeding. And even we can apply lalonine 3 to 4 times. It can be applied so as it will keep moist. And breast pump and shield can be used in case if it is a severe case. And even miconazole lotion can be applied, and even biopsy can be done to find out the underlying conditions. It may be due to some other condition. So to find out that, biopsy can be done. Now, breast infections, that is mastitis and subareolar abscess. So what is mastitis? It is the inflammation of the parenchyma of the mammary gland. What is mammary gland? That is the breast. So the parenchymal cells of the mammary gland will be inflamed. That is mastitis. And there are two types of mastitis, puerperal and non-puerperal. So here we are focusing on puerperal mastitis. What can be the reason? What can be the pathogenic organism responsible for this? It can be Staphylococcus, Streptococcus, gram-negative bacilli such as E. coli, Salmonella, Mycobacterium, Candida, Cryptococcus. Okay. This can be the organism that can lead to puerperal mastitis. So this is the, you can see the inflamed, reddened and hot vagina. Okay. So in inflammation, what are the signs of inflammation? Here, the skin will be red, it will be tender, and it will be warm to touch. So you can see the mastitis. Now the causes. So what can be the causes? Because of blocked milk ducts. What happened? Milk is produced, but it is being blocked, and excessive milk, cracked nipples, tight clothing, microorganism transference by patient and infant. If the baby is having some infection, it can be transferred to mother, and that can lead to mastitis. It is non-puerperal mastitis. Here can be due to hyperprolactinemia, but here we are not Focusing on non-pubertal, we are focusing on pubertal. So that what can be the causes? Blocked milk ducts and excessive milk, cracked nipples, tight clothing, and even microorganism transference by patient and the infant. Then symptoms: the breast will be tough. Okay, it will be tender, dull to severe pain, flu-like symptoms because it is inflammation. So in inflammation, the mother will feel feverish, flu-like symptoms, and that can lead to abscess. If the prompt treatment is not taken, if it is neglected cases, then abscess can be formed, and it is very rare. Okay. In non-pubertal mastitis, here you can see redness, swelling, hot spots, tenderness, pain, abscess, nipple discharge. So we are focusing on pubertal mastitis, tough, tender, dull to severe pain, tough texture, flu-like symptoms, and abscess. In treatment, we breastfeeding, and breastfeeding also we should take care. Proper breastfeeding technique should be demonstrated to the mother. Use of suction device, heat application, cold compresses, and antibiotics. Next is breast engorgement. Here what happens, it is a condition which occurs in mammary glands by expanding veins and the pressure of new breast milk contained within them. So breast engorgement means the breast will be engorged. Okay, so what happens, the mammary glands will be, which occurs in mammary glands, the veins will be expanded, and that will and even along with that there is production of more milk that can lead to breast engorgement. What can be the causes? Because of there will be exaggerated normal venous and lymphatic system, because breast is making more milk. So what happened? There will be exaggerated normal venous and lymphatic drainage. So that can lead to breast engorgement, and it is more common in primiparous women and women with inelastic breast. You can see the breast engorgement. Symptoms: the mother will feel pain, heaviness, generalized weakness, malaise, transient rise of temperature, and painful breastfeeding. Prevention is we should avoid prelacteal feeds. What is prelacteal feeds? It is a feeds which is a feed which we are giving before introducing the baby to the breast milk. In some culture, in some custom, what they will give honey or something gold, they are giving. So what happens? This can make the baby no, the baby will not be interested to suck the breast. That is pre-lacteal feed. So pre-lacteal feed should be avoided, and early and unrestricted breastfeeding, exclusive breastfeeding on demand, and correct position should be adopted during feeding. So what we have to demonstrate the proper breastfeeding technique to the mother. Management: we have to advise the mother to wear the bracer so as suppose the breast. Manual, if there is after after each feed, if the remaining milk is there, if we are feeling, if the mother is still feeling heaviness on her breast, we can advise the mother to manually express the milk. And if in case of pain, analgesics can be administered. And on demand, every 2 hourly, regularly at frequent intervals, breastfeeding has to be done. And if it is severe, if the pain and the discomfort and heaviness is very severe, then breast pump can be used, but gentle use of breast pump is recommended. Next is failing lactation, that the baby is not lactating and due to some reason lactation has not initiated. In one case is debilitating state of the mother. The mother's condition is very chronic. She is not able to uh, feed also. That is debilitating state of the mother. Early primigravida, failure to suck the baby regularly, depression or anxiety state in the puerperium, apprehension to nursing baby. Mother is anxious about nursing the baby. Premature baby who is too weak to suck and painful breast lesions. If the mother's condition is chronic, she is weak, okay, and if the mother is primigravida, early primigravida, so she doesn't have any, she is not able to do breastfeeding because she doesn't have that much information. She is not educated regarding this. And if the baby is not able to suck properly, if the mother is depressed, and if the mother is anxious, and mother is having fear or anxiety regarding nursing the baby. If the baby is premature, then in that case the baby will be weak. She is not able to suck, and if there is some painful breast lesions, this all can lead to failing lactation. So here, what is the management antenatally itself? We know that if it is early primary gravida, we know that that mother is not having any proper information regarding taking care of baby and even about the breastfeeding. So what education has to be provided to the mother during the antenatal period itself. And if there is any abnormality such as refracted nipple, has to be corrected. Breast hygiene has to be maintained, and general health status of the mother has to be improved. In postnatal period, fluid intake has to be improved, and nurse the baby regularly. If there is some painful lesions, it has to be treated. And if there is any remaining milk, residual milk after each feed, mother is still feeling heaviness or discomfort, we can encourage the mother to manually express it. And drugs like thyroid extract or prolactin can be helpful. Nowadays, we are providing um, bromocryptic. Okay, in case if the IUFD, intrauterine fetal death, has happened. Okay, so the baby is no more. So the mother doesn't need to feed the baby. Okay, because the baby is no more. So in order to stop the breast production of breast milk, bromocryptin tablet it is administered. It is given to the mother. Even the hormonal tablet like estradiol can be given to the mother. So today we discussed about the minor ailments as well as the complications of abnormal puerperium. Along with this conditions, there are some psychiatric disorders also during puerperium, so that we'll discuss in later classes.